This video is directed to the seasoned nurses and nurse manager on 4 North who will be orienting the new orientees in February 2017. In June of 2015, 8 nurses started orientation. Within 1 year, 4 of the 8 nurses resigned. That is a 50% staff turnover in 2015. Based on research, it has been determined that burnout, high stress levels, and high patient-to-nurse ratios were the cause of this staff turnover. According to Camisa, Peltzer, and Oldenburg, burnout is characterized by emotional exhaustion, depersonalization, and the lack of personal accomplishment. One nurse stated, "There were days where I did not have time to put my own needs first, and I just felt defeated, and that all my patients were unsatisfied, and that I couldn't be the nurse I came into this profession wanting to be." Because of burnout from prolonged work stress, there is an impact on job satisfaction which affects performance, nurses' well-being, and staff turnover. Because of the high number of staff turnover on 4 North, I've decided to perform a quality improvement project to increase staff retention within the next set of orientees. After discussing matters with the employees that have left and doing research, it is reasonable to set an aim statement of increasing new orientee staff retention to 100% among the new set of 8 orientees starting in February 2017, measuring weekly until February 2018. Currently, the factors that are affecting staff retention and turnover are the high nurse-to-patient ratios, the expectation from management to perform almost all the majority of care and not having the support from the management or assistants when needed, and there is a lack of understanding the differences of drive and retention strategies between the different generations on the unit. The plan to be tested will be to set a standard patient ratio at a max of 4:1 to increase job satisfaction. According to Hare, Salisbury, Johansson, and Redfern Vance, research shows that when nurses are exposed to inadequate staffing levels, they do not stay in their position. It was also found that it can cost as much as $80,000 to retrain a nurse. A 4:1 patient ratio will save each health organization $60,000 a year, and retraining one nurse with the recommended nurse-patient ratio can result in saving $140,000 a year. Goal 1. Set the maximum patient-to-nurse ratio to 4:1. We will keep track of how many patients the nurses are caring for and receive feedback weekly how they felt with this patient ratio, specifically asking if they felt their work was unfeasible, if they became stressed, and if they felt they would end up burned out and if they would be able to continue work on this unit for longer than 1 year. Goal 2. Focus on generational needs when managing nurses. Out of the 4 nurses that left the unit, there were 2 nurses that belonged to Generation X and 2 nurses that belonged to Generation Y. Generation X is driven by career advancement, shared governance, independence, and work-life balance strategies. For nurse retention, it is important to involve nurses in decision-making, allow them to create their work schedule if feasible, and offer skill-building opportunities. This will be measured weekly through feedback asking, is there enough independence in your work? Is there a home-life balance? Are there opportunities for self-growth? And do you feel you want to continue to work on this unit for more than 1 year? Generation Y nurses are driven by meaningful work, socialization, and networking. Retention strategies are to provide feedback often, encourage teamwork through the use of nursing pods, having 16 patients in which all the nurses in the same area help each other out, and measure with weekly feedback using, is this job meaningful? Does the environment feel like a team setting? Do you desire to work on this unit for longer than 1 year? Based on the changes made, including generation factors and nurse-to-patient ratios, along with the weekly feedback, there should be less staff burnout and increased job satisfaction. That will result in the end of 1 year, 100% of the employees that started will continue and desire to work on this floor. At the end of this year, this will be implemented as a standard of practice on the floor and will be spread to other departments in the hospital that will promote the same positive results hospital-wide.